name is Dr. Brian Lam. I'm a pharmacist in Newport Beach. We own a compounding pharmacy and also a travel clinic. In the travel clinic, it's important for you to get educated and vaccinated for developing third world countries. Places where there's poor sanitation or hygiene, countries of South America like Brazil, Chile, Ecuador, Africa, typically that continent too. So Tanzania, Kenya, South Africa, Ghana, and Southeast Asia like China, Thailand. You can drink the water here in the United States. There, you should be careful of the water you drink. For example, you shouldn't brush your teeth with the water and swallow it here in the United States. They treat the water, it's been processed, purified. In the showers too, you want to be careful of showering there. So anything ice and any cocktails especially, that's a transmission source that people don't think of. Don't want to drink the water in a developing third world country because it can increase your risk for hepatitis A, typhoid, and traveler's diarrhea. People's fingers, which is not good. That's the basic. Most people in developed countries use tissue if they have tissue. And then I guess the third option would be there's an old school version, like a neti pot. The sinus rinses is very hard to do because you have to do it in the bathroom or in your shower. Nasal cleanse is the more modern technology where it's a device and the benzalkonium chloride. Lubricate the sinuses and has some antibacterial properties for that to kind of cleanse the nose and clean the nose. It's more portable, more accessible. They can see a provider if they want to. That's educated in that. They can more than welcome to give them the vaccines if they have it, like hepatitis. Hep A is a little more specialized. Typhoid is definitely more specialized, but for diarrhea symptoms, they can give them antibiotic for severe diarrhea. But usually recommend over-the-counter products such as probiotics, first of all. You can use Pepto-Bismol, also Imodium. Imodium is good for if you really need to travel and you don't want to be stuck at the toilet or the outhouse area, you can kind of function and move around. Very few do, so they come here to kind of do a one-stop shop. So we kind of see what vaccines they've been on, see what their medication history is, see where they've traveled, and then basically educate them and let them know this is what's recommended. It's up to them to decide whether or not they want to go with the recommendation. Any malaria medicine we'll give them, any antidiarrheal stuff, any prescription stuff for like severe diarrhea problems, we'll give them that too as well. Typically, most side effects are like definitely a sore arm. Very rarely do you get like fever, headache, but typically those tend to be on more live vaccines. There's only a limited few live vaccines out there. MMR is one, yellow fever is one, but most other vaccines are recombinant, not live. So typically they're self-limiting. So like 12 hours, 24, 48, typically if they're gonna have a reaction, it'll be pretty much just a sore arm. Most people tolerate very well, but usually recommend just hydration, rest, and then they're usually fine. Get vaccinated, go see a health professional or a travel clinic specialist. Clean your nose. You can use a nasal cleanse to clean your nose. Wearing masks in the airports is good, or public transportation. While you're traveling in congregated groups or you're at high risk or immunocompromised, cleansing with a nasal cleanse product helps lower your chances of getting any sinus issues and any pollutants in your nose. Hopefully everybody stays healthy, stays well and safe, and enjoy their vacations and time with their families too.